and in the thorax only few contents are important. So the first important one is your imaginary plane passing between sternal angle of Lewis to IV disc between T4 and T5. What are the events happening in that important anatomical location? So number one is your beginning and termination of your arch of aorta. Beginning and termination of your arch of aorta. Number two is your separation of your superior and inferior mediastinum, people. So the mediastinum is divided into superior and inferior mediastinum, and inferior mediastinum is again divided into anterior mediastinum, middle mediastinum, and posterior mediastinum. Very important MCQ is heart lies on your middle mediastinum. So this superior and inferior mediastinal division occurs at the imaginary plane passing between the sternal angle of Lewis to the intervertebral disc between T4 and T5, and also the crossing of thoracic duct occurs here. And finally you have a bifurcation of pulmonary trunk and bifurcation of trachea in a living people. Bifurcation of trachea in a living people. So all the important thing are passing in this sternal imaginary plane passes between your sternal angle of Lewis to intervertebral disc in between T4 and T5. Very important MCQ, people. So the next one is your lung anatomy. Pretty important. High yield ones are your how many lobes are in your right lung and how many lobes are in your left lung. So the right lung is composed of 3 lobes, while your left lung is composed of 2 lobes. So the right lung, what are the lobes of your right lung? It is your superior, middle and inferior lobe, while your left lung only your superior and inferior lobe, and your superior lobe of your left lung contains a lingula. Very important, people. Lingula is present in what lobe of your lung? So the option is superior lobe of your left lung contains a lingula. Okay, so the hilar contents are pretty easy. Pulmonary artery, vein and bronchus are your hilar content of your left and right lung. So the next important one is your pleura, and pleura is composed of parietal and visceral pleura. Parietal pleura is the one which lies just above the ribs, and visceral pleura is the one which contains just below the ribs. Parietal pleura is the one which lies just below the ribs, and visceral pleura is the one which lies just above your lungs. So the derivatives of your parietal and visceral pleura is quite really important. So the derivatives are parietal pleura is derived from your somatopleuric layer, while the visceral pleura is derived from splanchnic layer. You should never forget this, people. Very important MCQ. So parietal pleura, somatopleuric layer, and visceral pleura, it is your splanchnic layer. So this is all about your lungs, and in the heart you need to know a few things. So the heart, boundaries of your heart is important, and blood supply of your heart is important, and what are the venous drainage and is your important things. So the boundaries of your heart, so the left boundary is formed by your left ventricle and left atrium, while the right boundary is formed by, or right border is formed by your right atrium. So right border, right atrium. Left border, it is left, so atrium plus ventricle. In the case of superior border, it is a left and right atrium plus great vessels, while in the case of inferior border, it is your right ventricle and your apex, and your apex is composed of left ventricle, while your base is composed of left atrium and a small portion by your right atrium. Every single border is important, people. You should never miss it. Every single border is important. And next, blood supply is also important. So the cardiac dominance is determined by a special artery known as posterior interventricular artery. So this posterior interventricular artery depending upon which coronary artery it is coming, that cardiac dominance will be determined. For example, is this posterior interventricular artery is arising from your right coronary artery, then then the person is right cardiac dominance. If it is arising from the left coronary artery, then the person is left cardiac dominant. So the right coronary artery gives rise to following branches. So the SA nodal branch and the right marginal artery, AV nodal artery and posterior interventricular artery if it is a right cardiac dominant. Okay. So these are the important one. So most important MCQ they're gonna ask here is SA node is supplied by SA nodal branch from right coronary artery, and AV node is also supplied by a right AV nodal artery from your right coronary artery. You should never forget this, people. And left coronary artery is divided into three main branches, namely left circumflex artery, intermediate branches, and anterior interventricular artery. So this anterior interventricular artery again divided into anterior diagonal artery and also septal branches, while left circumflex artery gives rise to four branches, namely anterior marginal artery, obtuse marginal artery, atrial branches, and posterior marginal artery. So these are the four branches from your left circumflex artery. So the most important MCQ they ask here is your SA node is supplied by what artery, AV node is supplied by what artery, cardiac dominance is determined by what artery, and so on. Okay, so you should know that. And venous drainage, there are only three important things. It is divided into cardiac veins, great cardiac vein, middle cardiac vein, and small cardiac vein. Great cardiac vein follows your anterior interventricular artery, while middle cardiac vein follows your posterior interventricular artery, and small cardiac vein follows your right marginal artery. Important MCQ is your small cardiac vein is followed by your right marginal artery.